Hi everyone, Dr. Harmon here. Today I'd like to talk about some of the options that we as facial plastic surgeons use to help reduce the risk of the development of abnormal scarring as well as to treat abnormal scarring if it were to occur. The first thing to mention is what is an enemy of good healing of incisions or other lacerations, and that is dryness and chronic sun exposure. So to that extent, we recommend keeping the incisions moist for long periods, as well as protecting those incisions from the sun, utilizing a mineral-based sunscreen with an SPF of 30 or greater. In the initial immediate post-operative period, the first few days, topical antibiotic is used to reduce the risk of infection. Then we transition to an emollient such as Aquaphor or Vaseline until about 14 days after surgery. Finally, we switch then to a silicone-based scar gel, and that would be used for approximately 3 months after surgery. Now, the incisions do continue to remodel and strengthen. For example, it takes up to 6 months for incisions to reach their peak strength, and that early postoperative period is very important in establishing the incision such that we can minimize the risk that abnormal scarring occurs. Now, what do you do if you notice some changes that suggest that abnormal scarring is developing, and or you meet someone who's coming from elsewhere, whether they've had surgery elsewhere, an injury elsewhere? How do you treat a scar that's already formed? Well, there are things such as injectables, and those include steroids of different concentrations and different types. That can help with the size and appearance of some scars. In some instances, fluorouracil, which is an off-label use of a chemotherapeutic agent, can be used to reduce the development of scars. It's often used in the lower eyelid if tightness is noticed in order to reduce the chances that that tightness turns into a scar that can cause issues. And those are two common injectable treatments used. There's some early evidence to suggest that Botox may help reduce the risk of scar formation. We don't exactly know why. It may be because the muscle being weakened on either side of the incision doesn't pull the incision as much, resulting in less tension on the incision site. But it also may be that the chemical cascade that results in the healing process is modified as a result of the Botox injection. And in that case, it will be a different mechanism by which scar formation or the appearance of the scar is reduced. There are resurfacing procedures that you can do, and those include things like a laser, such as a CO2 or an Erbiag laser. There are dermabrasion procedures that can be utilized, as well as chemical peels that can help with scarring. And finally, if those other treatments are ineffective or incompletely effective, scar revision is possible. Now, scar revision can be utilized not only to remove and reclose an area where a scar is formed, hoping that that incision then heals better than the previous incision or previous injury, but scar revision can also be used to reorient scars, to place them in creases and folds and along lines that may hide a little bit better. They also can have functional significance in that changing the direction or severity of scarring or the incisions can also reduce, for example, webbing around the eye, which is not only cosmetically displeasing, can also affect your blink, and also areas around the chin or jawline or neck where bad scarring can result in tethering of the neck and make it difficult to turn the head back and forth. So there are a lot of different options, and it really just depends on the time at which the incision or the injury occurred, what the incision or injury looked like currently, as well as specific aspects of the past medical history. So that's why it's important to have a conversation, a consultation with a facial plastic surgeon to help determine the best approach to reduce the risk of scarring, as well as to treat scarring if it's already occurred.